Hi guys, I'm going to talk to you today about the purpose for which I created this channel, and that is to, educate people about anesthesia and the steps to becoming an anesthesia provider. So today we're going to dwell on the topic, becoming an anesthesia provider. There are two pathways. The first one is through nursing school, and the second one is through medical school. So today we'll concentrate on the one through nursing school. So the nursing school one, we call them CRNAs, or Certified Registered Nurse Anesthetist, or Certified Registered Nurse Anesthesiologist. Now, and those going through medical school, we call them physician anesthesiologist. So as I said, today I'm going to concentrate on nurse anesthesiologist or nurse anesthetist through nursing school. What is the scope of practice for a CRNA or nurse anesthetist? So basically, they're able to administer anesthesia and pain relief to patients during surgery and other medical procedures. They're also able to prescribe medication, that is pain medications for the most part, including controlled substances. Where are the places that CRNAs can work? The CRNAs can basically work in hospitals, in surgical centers, in clinics, and in private practices. In the rural areas, mostly in America, and in clinics, they act as the only anesthesia providers. Whilst in the hospitals, they mostly work alongside with physician anesthesiologists as co-workers. Now, CRNAs practice independently in 23 states out of the 50 states in the United States, which means that in those states, there are no physician anesthesiologists working alongside with them. They basically work independently. What are the steps to becoming a CRNA? It takes about 7 to 10 years of education and training, 4 years for BSN, which is Bachelor of Science in Nursing, and then passing the NCLEX. Now, depending on how fast you can take the NCLEX and pass it, it can give you some room to kind of operate. Now, after passing your NCLEX, the next thing is to have about 1 to 3 years of experience in the critical care unit, mostly ICU or trauma and emergency centers. Then after you get that training, you want to get into anesthesia school. I must tell you, selection is very competitive because most schools, the highest they take is 25. Majority, and the 25 students that they take, it means it's coming from about 150 to 200 students who have been interviewed for the program. Now, about 90% of the schools will only accept 10 to 18 students out of this majority of applicants. Not even applicants, candidates that have been selected for the interview. Because every year, about 300 to 400 students will apply to just one school. And out of that, they will pick about 150 or more to interview. Then out of that, they will take about 10 students or 12 students or 16 students, maximum 25 students. And that is about only 2 schools that are able to take 25 students for this. So once you get into the program, you have 3 years to complete the program. And that is through didactic stuff as well as clinical stuff. So 3 years for that. Now, the 3 years, at the end of the 3rd year, you either get a DNP, which is Doctor of Nursing Practice, or a DNAP, which is Doctor of Nurse Anesthesia Practice. And these degrees depend on the kind of or the type of school that you choose. The school will determine what type of degree you are going to get at the end of the year, at the 3 years. And after you graduate from that, you have to pass your national certification exam, that is the NCE exam, and that is through the National Board of Certification and recertification for nurse anesthetists. Once you pass that exam, you begin your career as a CRNA. I must tell you, becoming a CRNA is a tough journey. But in life, success is usually not achieved on a silver platter for majority of people. So you have to work hard. You have to sacrifice a whole lot of stuff to be able to go through this program. But once you graduate, and job, you don't even have to go for a job interview for a job. They want you to come to the site, look at a place and tell them if that is where you want to practice. And just like that, you start working, basically like that. It's beautiful, it's rewarding. It's hard to go through, but once you graduate, it is rewarding. Guys, this is the end of today's video. I need you to subscribe to my channel so I can put more information here. Please subscribe, share, and comment. Any questions that you have, just comment, put it out there, and I will be glad to answer you to the best of my knowledge, and everything based on evidence-based practice. Thank you. God bless.